Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today, on this episode of Face the Facts, we're going to do another topic on the nose. And today, we're going to debut our possible title for this series, which is On the Nose, or maybe The More You Knows. Both of these have been suggested by patients. So today we're going to talk about dorsal humps. Now, dorsal humps are also known as the bump that people always notice on the side of their nose, on top of their bridge. And the dorsal hump is the official term for this. The hump can be composed of either bone or cartilage, and you can check for yourself if you push down on it if it seems like it's part of bone or if it's part of cartilage in terms of how hard it feels. But most people, it's a little bit of both. How we treat this then is different for each. If it is due to bone, it could be something as simple as kind of filing it down and rasping it down, or if it's due to cartilage, it might involve a little bit of shaving it down, usually using a scissor or a scalpel or something like that. Regardless of which technique is used to reduce it down, depending on how far it's been reduced down, it can create something called an open roof effect afterward, which is when, if you can imagine the roof of a house, you cut off the top part of the roof and now you kind of have this open roof situation. So we often will have to do what are called osteotomies, or breaking the nasal bones, to close the roof again. And if we come further down to the cartilage area, if you have too much collapse there, then what we often have to do is put a little bit of spreader grafts in that area, so that way you can just kind of smooth that overall transition. Now that is if we do a traditional style rhinoplasty, which is probably what most surgeons in the world are doing. However, the dorsal humps can also be treated with the preservation rhinoplasty technique, which is something as like a hot topic that you might be finding all over social media, as it's kind of had this resurgence. If you go the preservation rhino technique way, this hump part is actually left intact, but then other methods of reducing bone up here and some cartilage on the inside will actually push down on the hump, and that is what brings the hump down. If you go this technique, you don't end up needing to do necessarily the osteotomies or the spreaders because you are keeping the middle vault intact. So that's the preservation part of preservation rhinoplasty. The thing to know afterward about dorsal hump reduction is that because your skin is used to being swollen around a hump, especially if you had a really big hump, it is very likely that afterward, for some time after your surgery, it will still look as if you have a hump because of your skin being swollen up around it. And so this is one of those common parts that's hard for patients to realize, that the skin does need to contract back down to its new skeleton underneath, but before it gets there, it might still look like you have a little bit of a hump. Taping can help, and doing steroid injections can also help with that process. So that's today's episode on dorsal humps in rhinoplasty and nose jobs. We will see you guys next time on Face the Facts. My name is Dr. Lexie Wang in Washington, D.C.